Dear SI4CARE podcast listeners, welcome. Today we are joined by Professor Vlatka Martinović, whose background is heavily related to medicine, health management. Professor is also the head of several departments in different institutions with vast experience in research, mentoring, and training abroad. Dear Vlatka, you're also the director, or in terms of the SI4CARE project, the leader of the Health Insurance and Reinsurance Institute of the Federation of Bosnia and Herzegovina. So first of all, welcome to the podcast.
Thank you, Simon, for time, and thank you for this opportunity to represent our work here in Institute and our part as a project partner in SI4CARE project.
We are very happy to have you on board and also to have you as a guest in our podcast. So dear Vlatka, could you elaborate a bit on your personal experience regarding the elderly population in Bosnia and Herzegovina? And given your expert knowledge on health management, health insurance, and in general healthcare and long-term care, do you believe that healthcare and long-term care needs of the elderly in Bosnia are adequately covered, or do you maybe see any potential gaps in this field?
So as you already know, the situation in Bosnia and Herzegovina in the recent years was very difficult. Bosnia and Herzegovina was passing through the war and then the part after the war. And today we have one very unstable political situation. So all this affects the quality of the healthcare system and thus the care of the elderly population. In the recent years, only what we had here in Bosnia and Herzegovina were nursery homes that they were taking care about elderly. And also we have opening centers for healthy aging. In that way, they are going to help the older people to, in one way, try to easily live with their age and also help them in their daily life. As we consider all this, healthcare is the same for everyone. And so far, we don't have any like a separate geriatrics wards in the hospitals. And also, we little do on the prevention of the disease for the elderly population. And in that way, our elderly population is not very well satisfied with the healthcare system here in Bosnia and Herzegovina. Also, we showed that through our research when we were asking our population about healthcare system during our project. So I think in the next years, we have very challenging period to fix all this and to solve all these problems and to get better situation for elderly people here in Bosnia and Herzegovina.
Thank you very much for such a detailed answer. Now I would ask you, as the leader of project partner number 6, would you please present briefly your institution, so the Health Insurance and Reinsurance Institute, and maybe especially if we're talking about the strengths of your organization related to healthcare and long-term care.
So Institute of Health Insurance and Reinsurance of Federation Bosnia and Herzegovina is a public institution that has a leading role in ensuring universal access to financial sustainable basic package of health rights from compulsory health insurance, which affects the construction of the sustainable quality and the cost-effective health system to improve the health of Federation. Our vision is to develop the strength of the institution in the field of health sector that will be primarily patient-oriented in order to provide quality services in an efficient, economical, effective, and transparent way, and to ensure optimal level of patients' rights through the Federation of Bosnia and Herzegovina from the program under the jurisdiction of the Federal Institute, and to ensure quality observed through the ways of coverage and fair financing of healthcare of the insured people.
Okay, thank you also for this answer. In our project, in our field, we also talk about the importance of teamwork. So I would maybe ask you, how do you feel about, is teamwork important? And as a project leader at your organization, how did you select your team members and how do you ensure that everything goes according to plan?
So I agree with that teamwork is very important. How did I select the team members? I selected them because of their work on their job, because they have very demanding and difficult and positions in the institute, and that requires a great concentration during the work. So I thought those three girls will be good for this project. And they're very responsible persons, and they always finish almost everything on the time as we planned. So teamwork, as I said, is very important. And every time when we have like some problem or something that we need to do, we always have a meeting before that and a meeting after that. So everything is almost scheduled, and sometimes we work even late in the night to finish all our job that we have for this day. Working on this project for us is a pleasure, and because we are researching something new, we are learning new things, and on the end, our work contributes to the improvement of healthcare for the elderly people.
I think that you're really a great team, and that you also have great communication within your team. We're happy to have you on board, but still, do you maybe in the scope of the SI4CARE project see any important challenges on our future path, and how satisfied would you say that you are up to this point, how the project is functioning?
I'm very pleased and happy that we are, as an institution, part of this project. Through this project, we see the unity of the region, and I'm glad that we are working together to improve healthcare for the elderly people. We exchange our experience from different countries. We learned one from others, and I think we can do a lot together for the elderly in our countries in the elderly region, and we can be in the future example for all other countries around us.
So also based on your previous experience in working with different projects, how do you think that this project is maybe different in some aspects to the others that you were involved in the past? And how do you see the importance of our project in improving the well-being of members of our society in the region?
So I think the difference of this project is that we are doing something which are going to help the elderly people in their regions, in their countries, and the main strength of all us is that we are exchanging our thoughts, our plans, and that we are as a team discussing about everything, and that will help us to finish the main reason of this project, to help the others, especially older people in the region.
I think that that is a common wish for everyone that is involved in the project. Maybe if we turn back time a bit, when we were applying for the project, from the perspective of your organization, what were the expectations related to the SI4CARE project? And if we go into the future, what are some of the most important outcomes that you would like us to achieve with this project?
So when we are applying for this project, it was very interesting for us because, as I already said to you in the beginning of this interview, there is not such a good healthcare system for elderly people. We, as a health insurance institute, we need to take care about also our elderly people, because the biggest number of our people we are insuring is the elderly people, because during this period a lot of young people from Bosnia and Herzegovina is going out from this country, as we see that is happening in all other countries around us. So for us was the main part that we in one way help the elderly people, get them a good adequate healthcare system in our country. So because we are a small country and we are in this project with the countries who have more experience than we our wish was to learn from other countries around us, especially those people, those countries who are in EU So they're much more developed than Bosnia-Herzegovina, and Bosnia-Herzegovina is on the way to EU. So in that way, as we can say, we did one step ahead to that part.
I think it's great that you're also thinking about the future. If we focus on you as a guest, given your background and excellent knowledge in the functioning of public organizations, and if we link this with our project that is heavily related to policy making, to providing some insight to national stakeholders, what do you believe is the most important thing when developing transnational strategies, national action plans, and so on?
I think for developing international action plan is the most, and the transnational strategy, the main part is that we need to understand the policy of other countries, and then to see what of those that we're going to bring will be adequate and that people can use in their systems. And on the end, the third part is that we can follow our project later on in the years that will pass. So, and that this project doesn't stop on the end of this project, that this project continues to grow more and more in the future years.
Thank you for a detailed answer. I would then move on to my next question. So, given your knowledge on healthcare and long-term care in Bosnia and Herzegovina, how would you describe the term community care in relation to institutionalized care? Is this nowadays a viable alternative in your country?
I think this is not adequate at the moment, so we are working on that, that we improve this part. So as I already said to you, that our elderly people are not satisfied with the position that they have today in our country.
How would you describe maybe the future developments of elderly and demands for care in your country? If you, given your background and your knowledge that you gain also with this project, can give some projections?
Okay, during this project, we actually got a lot of information about opinions of our elderly population here in Bosnia, in Federation of Bosnia and Herzegovina. So what are the problems for our elderly people. In that way, we are going to continue developing and solving these problems. As you already know, the main part of our project is collecting the data about disease that our elderly people has, what they are treated for in hospitals. And in that way, we are going to make a plan which of those diseases are the most on the first place in the elderly population, and then try to find some solutions for them, and also try to suggest to our Ministry of the Health the programs for prevention and programs for getting better health care system for elderly people in our country.
Thank you. Then I would move to a more hopefully positive movement in the future. So we dealt with this COVID pandemic for almost 2 years. I think that hopefully now we are coming towards the end. I would say that this pandemic was responsible for also some disruptive changes. And given your background in medicine, do you believe that this will enhance the levels of telemedicine that are used also in the future?
As you know, the Bosnia-Herzegovina has a health system which is divided. We have 11 ministries of the health, we have 11 health insurance institutes, and so on. But during this pandemic time, this telemedicine, as I can say, united us because we are helping each other in all segments. And for our small country, like Bosnia-Herzegovina, telemedicine is the door to the world, and it also give us access to healthcare in all the parts of Bosnia-Herzegovina, especially the rural one. And we need to, as a country, work on the development of telemedicine in the future.
As a medical expert, would you say that telemedicine is also an important part of the future integrated care system?
Yes, Yes, of course.
Okay. So then we will move to the next question that is related to intergenerational relationships. And my first question would be, can you give us some insight into this topic in Bosnia and Herzegovina? So do you believe that the relationships between the elderly and the younger generation are good?
In Bosnia and Herzegovina, we have a family-oriented society, and family members help each other. So technology is developing very quickly, and sometimes it's very difficult for the older people to follow that. So I think young people need to help the older people, and society needs to provide technologies that they are accessible and easy applied to older people. So I think youth needs to help to older people in their life, help them in getting more included in society, and all this what they deserve during their life.
If we envision a future care system, do you think that policymakers today have some understanding of what the younger generations will require in the future? So, for example, when we get older, what will be the demand for long-term care?
I think that is the reason why I said that we younger needs to help the elderly, because one day we are going to be in the same position. So this is a time when we are learning how to help elderly people, that we understand the way how they're living, but that we understand their needs. And after maybe 10, 20, 50, 15 years or so, we are going to be in the same position. So I think we need to prepare the time where we are going to come. I cannot say soon, but in the future years.
Yes, you're 100% correct, because time is running out for everyone, I think. If we move on to the relationship between public and private healthcare, in Slovenia, the majority of care is provided by the state, so by public financing. Is in Bosnia the situation similar?
It's not very similar, but in Federation Bosnia and Herzegovina, our law for health system, in that law, private hospitals and public hospitals are equal in the term of rights, obligations, and so on. So people can get healthcare system in the private and also in the public institutions, in the hospitals. So it's the same for everybody. But in this time, private hospitals are growing a lot in our country. And during the pandemic time, they were growing very fast, because public hospitals were very busy with solving the problems of the COVID patients. And almost they were closed for all others, diagnostic procedures, operations, and so on, only emergency cases. So in this time, many people went to the private hospitals. And in some parts, our health insurance covers some of the operations and treatments and so on in the private hospitals.
Very interesting.
Yes.
Please continue. I'm sorry.
So I think what is the main important thing to understand, that the people, for their money, they want to have the best care system. So in the future, they are going to go where they can get it.
So do you think that it is also a realistic possibility that in the future there will be even more private services regarding care in Bosnia?
Yes, of course. At this moment, we have 3 hospitals, private hospitals, and a lot of private organizations where people go just for check-in and do diagnostics and so on. But we have 3 hospitals where people can do operations of the hearts. So very, very seriously hospital, not just some small things that they can do there.
That is really interesting to hear. Thank you. After reading your CV, there were a lot of stuff related to your professional background. but I think that people listening would also like to hear something interesting about you as a person. For example, what was really interesting to me is that you have a certificate that you can be a tourist guide, and that in your free time you are also the editor of a radio show. Can you maybe tell us something more about that?
Okay, when I was a student, I finished this course to be a touristic guide, and every summer I was working in Medjugorje. That is the place where many pilgrims are coming. It's a Christian place, and in that way I was, as I can say, earning my money for my education and my books for medicine, because they were very expensive. And also during that time, they were opening a radio station in Medjugorje. So they were asking the volunteers who would like to come there to work on radio. So I said I would like to try this. So for almost from 1997, I was working there as on radio. I was doing 2 shows. One show is like a quiz with the questions about religion, and the second show is about health. So I have my own show. In that show, I invite doctors, professors, and we talk about some disease problems in the health and so on. So I'm still doing this even after so many years. And I like that, and I like to work on radio. And I was doing the news and all these things, doing shows like leading some concerts and so on. So it was a good experience for me. Yes, sorry. And during this time when I was a guide, I met a lot of people from different countries, mostly from Ireland. And I have a lot of friends like during that time, and it's very good good job for the young people when they're starting their faculty and so on. Good to meet other people, get your social a lot of people in that, and also you can get some money for your school.
I think this is the most interesting thing that we ever heard on this podcast so far. So maybe for next time we can invite you as a guest, and you can prepare some questions for our next speakers, because you have so many experience as a radio show editor.
Yes, sure, but I wanted to give you some suggestions, because when you asked me about myself, what I do in my free time. So I would like to tell you that I like to cook. So when I was thinking about that, I get one idea. So because we have 10 countries here in our region, we can make a cookbook for and in that way we can get all the recipes from our elderly people, because we have projects for the elderly, these traditional recipes, and make a cookbook like a SI4CARE cookbook.
I think that would be a really interesting idea, and we can maybe discuss this in our next meeting in person. But I would advise that I wouldn't give any recipe, because I'm not the best when it comes to cooking.
Yes, but your grandmother or somebody from your family has some good recipe. Not you, but our elderly people can give us recipes.
Yes. I still have a book from my grandmother with all of her recipes, but unfortunately I can't do it in practice.
No problem, you just give me a recipe.
So that I don't take too much of your time, maybe to conclude our conversation for today, what would you say is maybe a key takeaway for the listeners of the SI4CARE podcast regarding the SI4CARE project? And as you're such a positive person, from the perspective of project partner number 6, maybe any positive thoughts for everyone involved in the project that we continue with our hard work?
So dear Simon, first of all, thank you very much for your time and these questions, and the opportunity that we can present our institution, Health Insurance and Reinsurance of Federation of Bosnia and Herzegovina, our work and our participation in the SI4CARE project. We are very happy to be part of this big and excellent team of Adrian region, and I believe that together we can bring new solutions to improve the healthcare of the elderly.
Thank you very much for your answers, for your time, and for your kindness. So today with us was Professor Vlatka Martinović, the leader of project partner number 6, the Health Insurance and Reinsurance Institute of the Federation of Bosnia and Herzegovina. Thank you very much for your time.
Thank you and have a nice day.